friends, welcome to Easy Nurse, where nursing education made easy. In this session, we will dive into the most important and expected topic of applied microbiology and infection control for third semester BSc. So, let's get started. So the first question is, write the mechanism and mediator of anaphylaxis and add note on its clinical importance. So what is anaphylaxis? So anaphylaxis is a severe allergic reaction that can occur when the person will get first contact with the allergen. So anaphylaxis is a severe, potentially life-threatening allergic reaction that occur rapidly after exposure to an allergen. It can affect multiple organ systems and require the immediate medical intervention. So if that allergic reaction will occur in the person for the first time, for that also we need immediate medical intervention. Next is causes. So anaphylaxis can be triggered by variety of allergen includes. First one is a food, second is an insect sting, third is a medication, latex and other triggers. So in the food, the person can get allergic reaction because of the peanuts, tree nuts, then shellfish, fish, milk, egg and soyas. Next one is the insect sting. So because of venom reaction from the bees and wasps and hornets, the person can get allergic reaction, anaphylaxis the person will get. Next one is a medication. So antibiotics such as a penicillin, non-steroid anti-inflammatory drugs and as well as anesthetics. So sometime when the patient go for the surgery, so prior that before the surgery, we used to do anti-sensitivity test to check whether that anesthetic is causing any inflammatory reaction or any anaphylaxis allergic reaction in that person. For that purpose, we used to do anti-sensitivity test because we have to check the medication is causing allergic reaction, anaphylaxis in that person or not. Next one is a latex. Allergic reaction to the natural rubber latex product. So the person can have allergy to the latex also. And last one is a other trigger such as exercise, certain medical condition or unknown causes. So this is the causes of anaphylaxis. Next, we will discuss about the mechanism of anaphylaxis. So in that, first one is a sensitization. So in the sensitization, the person will first exposure with the allergen and that allergen will leads to the production of immunoglobulin E and that immunoglobulin E will bind with the mast cell and the basophil. So this thing will first occur when the allergen will enter in the person's body. Next one is a re-exposure. So after that allergen will again expose with that person's body, then again that subsequent exposure, the allergen cross-link with immunoglobulin E on these cells and triggering denaturization and it release the mediator. So that again that allergen will bind with the immunoglobulin E and that will produce the cross-linkage. That will leads to a process of cross-linkage and that will trigger, that will produce the some sort of mediator such as a histamine. So this is the mechanism of anaphylaxis. Next one is a symptom. So what the symptoms will be developed because of anaphylaxis. So first one is a skin reaction such as itching, flushing, pale skin. Then in the respiratory system, difficulty breathing and cough will be there in the person. Next one is a gastrointestinal system. So in that nausea, vomiting, diarrhea, abdominal pain can be seen in the person. Next one is a cardiovascular problems. So rapid, weak pulse, low blood pressure and fainting will be there in the person, and in the neurological symptom, dizziness, confusion or loss of consciousness will be present in the person. So these are the signs and symptoms which we can see in the case of anaphylaxis. Next one is a treatment. So for that person, we need to do immediate treatment once that person get the allergic reaction. So first we will administer the epinephrine and that we have to administer in the intramuscular way. Intramuscular injection must be given to the person. Next one is a supportive care. In that we can give the oxygen therapy, intravenous fluid must be started in that person as well as medication such as antihistamine and corticosteroid to reduce that inflammation to stop that allergic condition. Next one is a monitoring. So in the medical faculty, monitoring must be done by the healthcare profession. So this is the management, this is the treatment of anaphylaxis. Next one is the dermatophytes. So dermatophytes are the group of fungi that can cause infection to the skin, hair and nails. Then these fungi are thrive in the keratin-rich tissue, and that's why they are mainly affecting our skin, nails. Next one is a dermatophyte infection are commonly referred to as a tinea or ringworm, despite the fact that they are not caused by a worms. So dermatophyte infection can be referred as a tinea. It is not causing because of worms, but still we are giving the name and we are referring it as a tinea as well as ringworm. Next one is there is a classification of dermatophyte, and this classification is on the basis of normal habitat. So on the basis of normal habitat there is three types. First one is a anthropophilic, next one is a zoophilic, and third one is a geophilic. So in the anthrophilic, that fungi will live on the human and that will can transfer easily by the human contact, and that can cause a mild or chronic infection in the human body. And the example of this anthropophilic is Trichophyton rubrum. Next one is a zoophilic. So in the zoophilic, that fungi will be present on the animal and it will transmit it, it will infect the human as well. So the example of this is a Microsporum canis. Last one is a geophilic. So geophilic fungi will be present in the soil and that can infect human as well as animal. An example of the geophilic is the Microsporum grapseum. So this is all about the dermatophyte. Next, we will discuss about the varicella zoster virus. So, varicella zoster virus is a highly contagious virus belonging to an herpes virus family, that is Herpesviridae, known as causing two distinct illness. So, it can cause two distinct illness. First one is a chickenpox as a primary infection and shingles as a secondary infection. Means primary, the person will get contacted with the varicella zoster virus. So, that time the person will develop chickenpox, and if that virus will again affect the person's body, then it will occur the shingles. So the transmission, how the transmission will be there. So in the chickenpox can be spread through a airborne droplet as well as it can spread through a direct contact with the fluid of the blister. So in the cases of chickenpox, there will be a blister formation on the person's body. So at that time, if any person is getting contact with that fluid of the blister, so that person can also develop the chickenpox. So chickenpox can be transmitted with the air droplet infection as well as it can be transmitted by the fluid of the blisters. So it is a highly contagious easily before the rash appear and until all the blister have crusted over. So it is highly infectious from the starting of that blister to that crushing of that blister, means it is highly contagious. After crushing of that blister, it is not contagious, but up to that period of time, means starting to ending of the blister, it is very contagious. Next one is the shingles. So shingles only transmitted by the blisters. Means if any person is get contact with that blister, so that person can be easily get affected, but it is not that much contagious. Next one is a treatment. So in the case of varicella virus zoster can affect any person. So in that case, what treatment options we can do? So first one is an antiviral. So in that case, we can use acyclovir, valacyclovir, flamciclovir can reduce the severity of the duration of varicella zoster virus infection, especially if administered early. So if means person initially started the symptoms, so at that period of time, if we administer the antiviral therapy to the patient, then that symptoms will be can easily reduce. Next one is a symptom relief. For symptom relief, we can give a cold compression as well as antihistamine medication, pain reliever to that patient to relieve the symptoms. So whatever the symptoms are coming in the chickenpox as well as shingles, so that can be reduced by the supportive measurement by the symptom relief. Next one, we will discuss about the prevention, how we can prevent these things. So vaccination is there for the chickenpox as well as for the shingles. So varicella vaccines is highly effective in preventing the chickenpox, while the shingles vaccines recommended for the adult over the 50, because the 50-year-old adult have more chances that they will get infected by the shingles, and that's why the 50-year-old person should get the vaccination of shingles. Then help to prevent the shingles and reduce its severity if it's occur. Next one is the infection control. We can isolate that person who is get infected because of chickenpox as well as shingles. Then particularly those with the chickenpox, help reduce spread. So if we isolate that person, so it will stop the spreading of that disease. So this is all about the varicella zoster virus. Next we will discuss about the life cycle of malaria. So the life cycle of malaria involving two hosts. So it will take place in the female Anopheles mosquito and as well as it will take place in the human. So there will be two hosts for the spreading for the cycle of the malaria. So this cycle consists of several stages in each host and with the parasite alternative between sexual reproduction in the mosquito and asexual reproduction in the humans. Means the sexual reproduction, the sexual replication will be there inside the mosquito, but once that enter in the human body, there will be a asexual reproduction we can see. So the causative agent for this malaria is a Plasmodium parasite and which having the four species. First one is a Plasmodium falciparum, second is a Plasmodium vivax, third one is a Plasmodium malariae and fourth one is a Plasmodium ovale. So this species can affect the human being and it can cause malaria in the humans. So we will see how the cycle is this. So first step is transmission to human. So what will happen in this stage? So the infection begin when an infected female Anopheles mosquito bites a human. So injects saliva containing sporozoites. So sporozoite will be there in the mosquito saliva and that sporozoite after injecting and after touching the human body that can spread into the human body. Infective form of the parasite into the bloodstream and sporozoite travel to the liver within the minute after entering into the bloodstream. So what will happen in this stage? That infected mosquito will transmit that sporozoite into the human blood. Next stage is a liver stage. So it is a erythrocytic stage. So in that stage what will happen? So that sporozoite will enter into the human liver and that sporozoite infect the liver cell. So it will develop into the schizonts. So schizont is the second stage that it will develop and the stage containing the multiple merozoites. So in the schizont there will be multiple merozoites present in the schizont and that schizont rupture release the merozoites into the bloodstream. So what will happen in the next step? This schizont is having more merozoites inside that and that schizont will get rupture and it will release merozoites in the bloodstream of the human. Next one is a blood stage, that is a erythrocytic cycle. So this merozoites invade the red blood cell where they develop into the ring stage, that is tropozoites, mature tropozoites and eventually schizont. So means again it is happening, means what is happening? Merozoite will be developed into the sporozoite and tropozoite into again a mature tropozoite and eventually it will develop into the schizont. And what will the schizont do? Schizont will again produce the merozoites. So rupturing of the RBC release the new merozoites which infect the more RBC leading to the characteristic cyclic fever will be there, chills is seen in the malaria. So because of this release of merozoites we can see symptoms in the patient, in that person. So fever will be there and chills in the patient of malaria. So this repeated cycle of invasion, maturation and rupture is responsible for the clinical symptoms of malaria such as the anemia and fever will be there in the person. And next stage is the sexual stage. So in this stage what will happen? The gametocyte formation will be takes place in this stage. So some of the merozoites which is released, so that develop into the sexual form called gametocyte. So that merozoite will be developed into the sexual form, that is a gametocyte. So one merozoite will be a male and one merozoite will be a female. Then within the red blood cell, instead of continuing asexual reproduction, gametocytes circulate in the bloodstream awaiting uptake by the mosquito for the further development. So that gametocyte will be further developed and that it will get fused. So next one is a transmission of mosquito, that is mosquito ingests gametocytes. So when another female Anopheles mosquito bites an infected human, it ingests the gametocyte along with the blood and meat. So in the mosquito gut, that is gametocyte develop into the male and female gametes which fuse form of zygote. So that male gamete and female gamete will ingested by the mosquito, means if the mosquito bite any person, so that gametes will enter into the mosquito inside and that will get fused together. Next one is a mosquito stage, that is a sporogonic cycle. So that zygote develop into the motile eukaryote. So once that fusion will occur, the zygote will be produced and that zygote will develop into the eukaryote which penetrate the mosquito gut wall and forms a oocyst inside the oocyst. So multiple sporozoids develop and eventually leads to the mosquito salivary gland, and this cycle now complete and mosquito is ready to infect the another human host. Means what will happen? After the ookinete is developed, there will be a formation of oocyst, and after this oocyst is developed, sporozoite will be released from that oocyst, and again it is ready to infect the another human. So this is the cycle of malaria. We will see in the diagrammatic form how it will be takes place. So what will happen? So this infected mosquito will bite the human, and after that biting, that sporozoids will be spread, and the sporozoid directly go into the hepatocyte, directly go into the liver. So in the liver, these cells will be converted, this cell will be developed into the schizont, and this schizont will convert and will develop the merozoite inside it, and that merozoite will release by the bursting of the schizont. And after this merozoite formation, there will be a cyclic representation here, you can see. So that will convert into the tropozoite, and tropozoite will get developed into the schizont, and again this schizont will develop and release more merozoites. So after this, what will happen? In the human body, there will be some merozoites will be a male gamete and some merozoites will be a female gamete, and that gamete formation will be there, and as well as microgametocyte and macrogametocyte you can see in the human body. And one again, that Anopheles mosquito which injures or bite that infected person, so that gamete will go inside the mosquito's gut, and in the gut there will be a fertilization thing will happen there, and there will be a zygote formation you can see, and that zygote will develop into the ookinete, motile ookinete, and this motile ookinete will develop into the oocyst, and this oocyst will again release the sporozoites. So sporozoite is our first step. So that sporozoite will be present and go into the salivary gland of the mosquito, and that mosquito is ready to infect the other person. So in this way the malaria cycle will be takes place. Next we will discuss about mention two special microscope and mention one use for each. So here we have to mention the two microscope. So first one is an electron microscope, which we use for highly detailed image at the nanometer scale, useful for observing cellular structure, viruses and other small biological specimens at the high resolution. Means whatever the things which are very small, so you can watch and you can see the structure of the cell, viruses and bacteria with the help of electron microscope. Next one is a confocal microscope. So in the confocal microscope, with the help of 3D image, you can see the thick specimens. Means what is inside that, you can observe the various cells inside that, and it is high optical sectioning ability it is having, and minimal background noise. So it will reduce and it will minimize the background noise, and only the thing which we have to observe, we can observe under the confocal microscope. Next one is a prophylaxis of poliomyelitis. Means we have to prevent the spreading of poliovirus, polio. For that we are doing the prophylaxis measure. So the prophylaxis or prevention of the poliomyelitis, a viral infection caused by the poliovirus, relies primarily on the vaccination. For this we are having vaccination, and for this we can do the vaccination to the people of community, and in that way we can prevent the spreading of poliovirus. So polio prevents the efforts have been highly effective, drastically reducing the incidence of the disease worldwide. So because of this poliovirus vaccine, because of this prophylaxis, the spreading of poliovirus is reducing day by day. So we will see whatever the prophylaxis measure that we can use. So first one is a polio vaccination. So in the polio vaccination we can see inactivated polio vaccine will be there. So inactivated means the virus will be here. Inactivated means the kill virus we will ingest into the person body, and that killed virus will be develop natural immunity in the person's body. So administer as an injection IPV content inactivated and killed virus, and it is a safe and effective. Next one is a oral polio virus vaccine, means OPV. So it contains the live and attenuated, means the virus we will ingesting in the person's body, it is live, but it is weakened, means it cannot harm the person's body. So we are administering the attenuated, means weakened polio virus in the person's body, and is taken orally. So OPV include immunity in the gut, where the virus replicate, helping to prevent the transmission. So this OPV, oral poliovirus vaccine, will mostly work on the gut, because in the gut there will be a replication of the poliovirus. So in that way this oral polio vaccine will be worked. Last one is a mass immunization campaign. So in the mass immunization campaign there will be awareness, and there will be work done by the Global Health Organization. For the campaign aim for widespreading of immunization to achieve the herd immunity and interrupt transmission. So this Global Health Organization will work, and they will arrange the campaign for the spreading of the polio virus, and they will arrange the vaccination against the polio virus. Next one is the surveillance and quarantine. So in the surveillance, the area in which we can see the most of the people are having polio virus infection. So in that area we can keep on eye, we can do the surveillance, and we have to early detect that case, and we have to do the treatment modalities first, and we can isolate that person who is infected by the polio virus. So in the surveillance of the potential cases, especially in the polio endemic area. So in the polio endemic area we have to keep the special surveillance, we have to keep our eye on that area. So is a crucial for early detection and response. So it will help us for early detection, as well as we can give the response and treatment according to the situations, according to the spread of infection. Next one is the isolating cases and monitoring sewage for the polio virus help contain outbreak. So we have to keep the eye, and we have to isolate that person who is infected by the polio virus, and we will keep the eye on the sewage water. Means because of the sewage water, that polio virus will be infecting the other person, and that polio virus is transmitting and that replicating in that sewage water. So we have to keep eye on the sewage water, so it will not get spread, the outbreak will be not there. Next one is a maintaining high immunization coverage. So we have to give the vaccination to the more and more people, so that polio virus cannot affect the persons of the community. So sustaining high vaccination rate prevent the reintroduction and spread of virus in the polio free areas, ensuring the long term protection. So if the people of the community are vaccinated against the polio virus, so if that virus will come back for infecting the person, so they will not get infected because they are already vaccinated. So this is the last one, that is a maintaining high immunization coverage. Next one we will discuss about the contribution of Louis Pasteur. So Louis Pasteur is a microbiologist and chemist, made foundational contribution to the science and medicine. So his work led as a groundwork for the microbiology, immunology and modern public health. Here are some of the most significant contributions. So Louis Pasteur is microbiologist, chemist also, and he is having his contribution in the science as well as in the medicine, and he worked in the microbiology field and immunology field. Next we will discuss about the contribution that Louis Pasteur has Louis Pasteur has made. So first one is a germ theory of disease. So previously it is believed that the disease is causing because of curse or because of impure air. So Louis Pasteur is the first one who told the disease is causing because of germs, because of some bacteria, because of some viruses. So the Pasteur experiment demonstrated that microorganisms cause the fermentation and diseases. So Pasteur is the first person who told the fermentation is taking place because of germs, as well as the disease is causing in the human body because of germs, challenging the prevailing theory of spontaneous generation. So his work provides the scientific basis for understanding the infectious disease. So the work he done, it will provide us a scientific basis how the disease is occurring, and according to the germ condition we can do the treatment modalities, so that and paved the way for modern microbiology and hygiene practice, as well as he give his contribution how to maintain the hygienic practice. Next one is pasteurization. So pasteurization is a method that we can apply to prevent the food from get spoiled, from get waste. So the pasteurization is a method which is also developed by Louis Pasteur. So the process of pasteurization, it is developed by Louis Pasteur. The method of heating liquid such as a milk, wine to kill the harmful microbes without compromising the quality. So here with the help of pasteurization we can kill the microorganism without disrupting the quality of that food. Okay, so that method is also developed by Louis Pasteur, and this process revolutionized food safety and significantly reduced the spread of foodborne illness. So foodborne illness is also stopped because of this pasteurization method. Next one is the vaccination. So vaccination against the rabies, anthrax, it is developed by Louis Pasteur. So demonstrating that weakened and inactivated pathogen could provide the immunity against the disease. So he is the first one who told that inactivated pathogen as well as weakened pathogen can provide the immunity in the human body. Then his work in the immunology established the basis for modern vaccination benefiting both human and veterinary medicines. Next one is the fermentation. So Pasteur discovered that specific microorganisms were responsible for the fermentation. So he also discovered that whatever the microorganisms are involved in the process of fermentations. So industries like wine making and brewing. So his research showed that controlling microbial growth could improve the product quality. So he did the research, and in that research he found that how to maintain the quality of that product without destructing the quality. You can kill the microorganism, you can control the microorganism growth. So could improve the product quality, contribute to the field of the microbiology and biochemistry. And last one is a sterilization technique. So sterilization technique, how to sterilize the instrument which is used in the hospital side. So that how we can sterilize. This technique also is developed by the Louis Pasteur. So his advocacy for the sterilization and cleanliness in the medical procedure based on his germ theory work. So whatever he discovered in germ theory work, he have applied in the sterilization technique and inform antiseptic techniques and lead to the safer surgical and reduce the infections rate in the hospital side. So by applying this sterilization technique, by innovating this technique, the Louis Pasteur has made great contribution in the prevention of infection. So this is all about the contribution of Louis Pasteur which have made. So this is all about the today's session. I hope you have understand. For more such videos, do follow Easy Nurse. Until then, bye bye and take care.